Welcome to this e-learning program. This is Ramakrishnan from the Reformed Agency, St.Joseph College of Arts and Science, Cuddalore. In this program, I am going to discuss the topic hypertension, which is also called as high blood pressure. It is a condition in which the force of blood against the arterial wall is persistently too high. So that is called hypertension. So before to discuss the hypertension in detail, first we should know what is meant by blood pressure. So it is the force which act on the blood vessels, particularly artery, because of the flow of blood. So blood flow because of heart pumping. So the main functions of heart are pumping of blood and transport oxygen and nutrients to the entire system for cellular action. Then same way it collects the waste material from the cellular components and helps for excretion. And finally maintaining the blood pressure and regulating the normal blood flow. So these are all achieved by the function of heart. So that function heart will be achieved by two ways. One is contraction, another one is relaxation. Contraction is called systolic and the second one is called a diastolic. So because of these two kinds of movements, that will generate two different forces in the flow of blood through the blood vessels, particularly artery. Okay, so that is why there are two values will be experienced in the artery. So first one is called the systolic blood pressure. Second one is called the diastolic blood pressure. It is always expressed in the mercuric pressure. Okay, so the normal level is 120/80 mercury. So if the value is 120 to 129, then it is called elevated blood pressure. It's like a moderate. Then if it is more than 130 to 139, then this stage is called the stage 1 hypertension. More than 140, it is called the stage of hypertension. Generally, signs and symptoms are all observed only in the stage 2 hypertension. It is very rare to find out in the first stage. So many people have these conditions but do not know it is because of usually have no signs and symptoms in the initial stage. With proper medical care and treatment, it can be treated. Otherwise, it may lead to heart attack, stroke, dementia, kidney disease, and so on. So, literature survey shows that approximately 762 million Indians are affected by hypertension, and this ratio is very high in the urban areas when compared to rural. When we look at the measurement of hypertension, how shall we measure? So by two ways. One is manual, then second one is automatic. So manual method is based on the usage of sphygmomanometer. Usually everyone might have experienced in the general clinic healthcare. Okay, the first case, to measure the blood pressure, the healthcare provider will ask the patient to relax for a few minutes, then wrap a cuff around the upper arm and inflate it temporarily to flow the blood. The cuff will then be slowly deflated while the healthcare provider listens the sound of blood flow using stethoscope or latest automatic device. That is the method to measure the blood pressure. What are the common causes for hypertension? So when we know this causes, it is easy to control or manage the hypertension. So first thing, high salt food intake, or obesity, or lack of physical activity, alcohol consumption, or smoking, in some cases by genetic, and most important one is stress. This is the vital one for causing hypertension. So when we know the reason for hypertension, it is very easy to control. Now, what are the common signs and symptoms of hypertension? Severe headache, nosebleed, and shortness of breath, blurred vision, confusion, chest pain, and sweating. These are all the common signs and symptoms for blood pressure, but it will be observed only in stage 2. that is somewhat very high. Management of hypertension. High blood pressure management involves a combination of lifestyle changes and, if the necessity comes, proper medical advice from the doctor. So key lifestyle adjustments includes that adopting the hot healthy low sodium diet, engaging the regular physical activity, stress management, maintaining the healthy weight, then quitting smoking, getting sufficient sleep, and if the necessity comes, tablets will be taken with the recommendation by doctors. Thank you.